Hello, my name is Fenella, and I'm a master's student at the University of Winchester. Today, I'm going to talk to you about onychectomy in cats. In today's presentation, we will be covering the following: the definition of onychectomy and the techniques available to perform it, the origin of the procedure, the legal standing around the world, the arguments for the procedure and the evidence which shows that these arguments are not strong, welfare concerns related to the procedure, available alternatives, recommendations for how society can progress to a full ban, a summary of the presentation, concluding remarks, and finally, references. Onychectomy, also known as declawing, is a surgical procedure resulting in the amputation of the third phalanx bone of the toes. These are the bones circled in red on the diagram. Most often, this is done as an elective procedure in order to stop cats from scratching inappropriately. Typically, this is only done on the front feet, although the back feet may be involved too. Rarely, the procedure may be done for medical reasons, such as fractures, incurable nail infections, or neoplasia. This presentation will mainly be discussing the use of the procedure in an elective manner. There are three main methods for this procedure, all of which should be performed by a qualified veterinary surgeon under general anesthetic and with appropriate pain relief. The first method is called the guillotine technique and involves using a pair of sterilized guillotine nail clippers to sever the digit at the appropriate place. This technique is less commonly used now, as it has been found to have an increased risk of leaving portions of the third phalanx bone behind, which can cause future issues. The second method is called surgical disarticulation and involves using a scalpel blade to disarticulate the digit. The surgeon can be more precise with this method than with the guillotine technique. The third method is performed with a carbon dioxide cutting laser for disarticulation. This technique requires equipment that can be expensive, so it is not available to all veterinary clinics. Some argue that the laser method is the most humane method. However, while Clark et al. Showed that there may be less post-operative complications compared to the other two methods, there seems to be no difference in the level of post-operative pain. So, how did this procedure come about? The first known publication referring to the decline of cats was a letter by Meisner published in the Journal of the American Veterinary Medical Association in 1952. The technique then became more popular in the US and Canada in the 1970s, often routinely being done at the time of neutering. A study in 2001 estimated that just over 24% of cats in the US were declawed. A more recent study in 2014 showed that this percentage had dropped very slightly to around 21%, although this study was regionally limited to the area around Raleigh, North Carolina, so this percentage could be different in the US as a whole. There are no available estimates for numbers in other countries, although in a 2015 survey of Ontario veterinarians, 24% reported not performing onychectomy, and 60% of those who did perform the procedure reported doing so less than monthly. This suggests that the portion of cats declawed in Canada will be lower than in the US. Often seen as a controversial technique, the legality of decline varies across the world. Many countries, such as the UK, those in the EU, Japan, Brazil, Australia, and New Zealand, have banned the procedure as an elective surgery. Within the US and Canada, legality differs regionally. 2 US states have banned it completely, and there are a number of cities across the country which have instituted prohibitions on the procedure. In Canada, 7 out of 10 provinces have banned it, with a ban in Quebec coming into place next year. The main reason for the elective decline of cats is to stop destructive scratching behavior on furniture and people. Supporters of the procedure believe that scratching of people could lead to health issues, such as the passing of some diseases or breaking of skin on people with fragile skin conditions or bleeding disorders. However, the Center for Disease Control in the US does not recommend declawing cats as a method of reducing risk. Rather, they recommend avoiding rough play and using appropriate hygiene measures. There is also some evidence that declawing cats might actually increase the incidence of biting, which can be a greater risk to human health. One study showed that humans attending A&E with only claw injuries did not develop infections, whereas those with cat bites did in 15.6% of cases. There is also a belief that without the option of declawing, more people would surrender their cats due to their destructive behaviors. However, studies show that in actuality, only a small percentage of cats given up for adoption to rescue centres are surrendered for destructive behaviors. And additionally, in British Columbia, there was no increase in the number of surrendered cats after the declawing ban came into place. There are a number of welfare concerns relating to the procedure of declawing. First is pain. As with any surgical procedure, this surgery is painful. This pain can be both short-term and long-term, and it may be related to neuropathic pain, residual inflammation, infection, or remaining bone fragments. There have been several studies looking at pain relating to the procedure. Tobias showed that 5.5% of cats were completely non-weight bearing on the affected limbs for 1 day after the operation. 37% showed signs of pains for a median duration of 2 days, with one cat showing lameness up to 54 days post-procedure. Clark et al. Showed that 13.6% of cats were still mildly lame at the long-term recheck, which varied from 1.3 to 9.5 years post-surgery. Martel-Moore et al. Showed that declawed cats have an increased risk of back pain compared to non-declawed cats. These cats also showed an increased risk in berberine, which has been shown to be a sign of pain in cats. Second is surgical complications. In one study, a whopping 50% of cats had one or more complications in the immediate postoperative period, with 19.6% developing a complication after being discharged home. The main complications are hemorrhage or bleeding. Tobias showed intermittent hemorrhage occurred in 31% of cats for 1 to 13 days post-surgery. Claw regrowth, which is a consequence of incomplete removal of the phalanx bone. As previously mentioned, this is most commonly seen with the guillotine technique. Regrowth has been reported to occur in 3 to 10% of declawed cats. This regrowth can result in abscess formation and pain, as seen in the photo on the slide here. Wound breakdown is another potential complication, which can lead to delayed healing, pain, bleeding, and infection. This was seen in 17% of cats in one study. Infection of the operative site may be seen in up to 11.6% of declawed cats, which is significantly higher than the 4.7% reported infection rate for other clean procedures in small animal surgery. Third is behavioral changes. Scratching is a normal behavior in cats, which helps condition their claws, deposit scent marks, and also helps stretch and develop their muscles, particularly in the shoulders. Removing this ability can impact on their freedom to display normal behavior, one of the 5 freedoms of animal welfare. There are also studies which have shown that declawing can increase problem behaviors such as biting, aggression towards humans and other animals in the house, and house soiling. With the above-mentioned welfare concerns of declawing, we obviously need alternatives to this extreme procedure, but still reduce the destructive behavior which can affect the bond between humans and cats. The first one is behavior modification, to train cats to scratch appropriate locations, such as scratch posts. It is important for humans to understand that cats often have preferences in the type of post or scratcher available to them. Studies have shown that most cats prefer cardboard or rope-covered scratchers, although this does seem to be different for older cats who prefer carpet. cats also prefer vertical scratchers to horizontal. The more scratchers available, the better. Guardians can also use catnip or pheromones to improve the use of scratchers. Punishment of cats who are scratching in an inappropriate place does not work, with studies showing that it can actually increase the unwanted behavior. Humans can also learn how to trim their cat's claws, so when they do scratch, it causes less damage. Most cats tolerate clipping well, and it is easier to do than in some other companion animal species, due to the nails being clear, so the quick is easy to see. Guardians who are uncomfortable with trimming them can also take them to a veterinary clinic or groomer to do the clipping. Usually, the nails will need to be trimmed every few weeks to keep them at an ideal length. Another alternative are nail caps. These are soft vinyl caps which are glued to the surface of the cat's nails. They usually stay in place 4 to 6 weeks and can be applied either at a veterinary clinic or by a trained guardian. They usually fall off on their own, although sometimes removal is required. Again, most cats tolerate these well, although some cats may need to be sedated for the procedure, which can make it a less appealing option. It may also prevent shoulder muscle development, which occurs secondary to the pull during scratching, since the cat will not be able to get any purchase while it is displaying this behavior. Declawing is becoming more and more of a controversial topic, and as discussed previously, the procedure is banned in an increasing number of places. Pressure is building from a number of invested groups for those geographical areas that have not yet prohibited the technique to do so. The Cat Fancy Association of America has stated that it disapproves of the technique and it does not allow any showing of affected cats. Several veterinary associations, such as the International Society of Feline Medicine, the World Small Animal Veterinary Association, the American Association of Feline Practice, the American Animal Hospital Association, and the Canadian Veterinary Medical Association all state that they strongly oppose the practice. The American Veterinary Medical Association discourages it, but does not outright oppose it, instead leaving the decision up to the individual veterinarian. This association could look to follow its Canadian or British colleagues in objecting to it outright. Vets themselves can also refuse to do the procedure. The corporate group of Blue Pearl, Banfield, and VCA in the US, which owns over 2,000 clinics and employs over 10,000 vets, has recently developed a policy that they will no longer perform declaws in their clinics. Individual practices can also sign up to the No Declaw list run by the PAW Project. Finally, it is important to educate guardians themselves on the procedure and make sure they understand all the options available before going ahead with any surgery. To summarize, declawing is an elective procedure involving the removal of the third phalanx bone, most commonly performed in the US and Canada. This procedure can lead to pain, bleeding, and other postoperative complications. It can also lead to negative behavioral changes, such as biting and house soiling. There is no evidence that declawing would reduce the number of cats surrendered to shelters. Therefore, there are no welfare benefits of this procedure for cats. There are alternatives to declawing cats which can all be successful. Therefore, it is never right to declaw a cat for convenience. To conclude, declawing should be banned as an elective procedure. It has no benefit to the cat, only to humans. It should only be allowed for medical reasons. Thank you for listening. Here are the references for those who are interested.